Welcome back, everyone, to another deep dive. Today, we are going to be tackling some pretty serious stuff.
Yeah.
We're going to be looking at all sorts of medications used in mental health.
Yeah.
You actually sent over a document with just, I mean,
Yeah, it's massive.
it's a huge list of just drugs.
Yeah, it's a lot of information.
Yeah.
It's everything from like the generic and brand names, how it's classified, basically what kind of drug it is,
Right.
what it's used to treat, the potential side effects, and then also some really important nursing considerations as well.
Okay.
It's pretty comprehensive.
So if somebody is listening right now and they want to learn a little bit more about this stuff, whether it's for, their own personal knowledge, or they have to talk to a doctor or nurse about this, or just out of curiosity, this is a good place to get started.
Absolutely. This is like a really good foundational deep dive
Okay.
into some of these medications.
So that's our mission here today, is to extract the most important information from this document and deliver it to you in a way that is clear and engaging and hopefully helps you to learn a little bit more about this stuff
Yeah, we'll keep it interesting
without getting bogged down in the weeds too much.
and highlight some of the key takeaways. Yeah.
Okay, so we're going to start alphabetically with the generic names. And we're going to start with amitriptyline, which is also known as Elavil. That sounds familiar, right?
Yep.
Okay, so this is, according to the document, classified as a tricyclic antidepressant.
So these guys, these types of antidepressants work by affecting the levels of certain chemicals in your brain.
Okay.
They work on neurotransmitters like serotonin and norepinephrine,
Okay.
and they help regulate mood that way.
So amitriptyline, primarily, it says, it's used for major depression and suicidal thoughts.
Some pretty heavy stuff.
Yeah. And then we look at the potential side effects, and there's some big ones here. Suicidal thoughts,
Oh,
hypertension, which is high blood pressure, something called serotonin syndrome,
right.
which we'll talk a little bit more about later. It's basically too much serotonin in the brain.
Exactly.
Tachycardia, which is a rapid heartbeat and blurry vision.
Yeah.
Now, when we look at the crucial nursing consideration,
Okay.
some really important stuff here.
Yeah.
First of all, shouldn't be given to patients under 12 years old,
Right.
and also contraindicated if the patient has taken what's called an MAO high, which is another type of antidepressant in the past 2 weeks.
Yeah, that's huge.
Yeah, it's really important to have that 2-week gap because using these medications too close together can lead to some really bad interactions.
Yeah, exactly.
And of course, just like pretty much everything, you should avoid alcohol.
Right, which makes sense.
It also says it's best to administer this with food or milk.
Oh, okay.
And something that I find really important here is it says that, we need to report symptoms of serotonin syndrome, like fever, muscle twitching, changes in mental state, and also any suicidal thoughts.
Oh,
Really important to be monitoring for any changes when you're taking this medication.
absolutely. And I think it really shows how
Yeah.
how much both the patient and the caregivers need to be really on top of things to make
Yeah.
sure everything's okay.
Okay, so moving on, the next one alphabetically is bupropion, which you might know as, Wellbutrin or Zyban.
Yes.
This one I find really interesting because it's an SNRI, so it works on different chemicals in the brain than a tricyclic, but it's also a smoking cessation aid.
That's so interesting.
Right, a dual
It's
purpose.
a dual purpose drug, yeah.
So the primary use of this medication, it says, major depression, smoking cessation, and seasonal affective disorder.
Okay, so kind of all over the place.
Yeah. Now the side effects here: seizures, suicidal thoughts, homicidal thoughts,
Oh, wow.
dysrhythmias, hypertension, headache, confusion, insomnia.
That's a lot.
Yeah, that's a big, big list. So nursing considerations
Hmm.
should not be used in children, and it also should not be used with other central nervous system depressants. And of course, avoid alcohol and CNS depressants.
Got it.
Best to administer this with food or milk,
Okay.
and it can cause photosensitivity, so an increased sensitivity to sunlight.
Interesting.
Yeah, really interesting stuff. I'm fascinated by the dual purpose of this, as an antidepressant and a smoking cessation aid.
Yeah, very interesting. I wonder how it works.
Yeah, how does it do that?
Yeah, how does it work?
And also that really important thing about not using it with other depressants.
Right.
Super important to make sure that your doctor knows everything that you are taking.
Absolutely.
Okay, the next one is buspirone, also known as Buspar.
Okay.
So this is classified as an anti-anxiety, primarily used for anxiety disorders, primarily generalized anxiety disorder.
Okay.
The potential side effects: serotonin syndrome,
Okay.
rash, sweating, pain, weakness, drowsiness.
Right.
So the nursing considerations here: contraindicated with MAOIs and SSRIs.
Oh,
Also contraindicated in pregnancy.
okay.
Administer with food or milk, but avoid grapefruit juice.
Oh, interesting. That's specific.
Yeah, it is their specific.
Yeah.
Suggest gum or hard candy for dry mouth, and avoid activities that require alertness.
Yeah, that makes sense for anxiety medication.
Yeah. It's really interesting that it mentions grapefruit juice specifically.
It is. Yeah, I
I
wonder.
wonder why that is.
Yeah, why that is.
Like, there's something about grapefruit juice that interacts with this drug.
Right, right.
And that's fascinating. And also a really simple practical tip, use gum or hard candy for dry mouth.
Right.
Okay, next we have chlorpromazine, also known as Thorazine.
Okay.
So this is classified as an antipsychotic,
Okay.
used primarily for things like schizophrenia, psychosis, and mania.
Right.
And this one has a really serious side effect right at the top. It says increased risk of death in elderly patients with dementia.
Oh, wow.
That's something to be really aware of.
Yeah, that's huge.
Other potential side effects, tardive dyskinesia,
Okay.
which is involuntary movements of the body, Parkinson-like symptoms, dizziness, dry mouth, rash, and drowsiness.
So, it sounds like the nerve considerations here are pretty important.
Yeah, they are very important. It says monitor for something called neuroleptic malignant syndrome, or NMS,
Right.
which we'll talk about a little bit more later.
Okay.
Also monitor for signs of infection
Okay.
and assess blood pressure, heart rate, and any allergic reactions.
Wow. Wow.
Yeah. So the really scary things here are the increased risk of death in elderly patients with dementia,
Right.
and the fact that we have to watch for these neurological issues like tardive dyskinesia
Yeah.
and also signs of infection.
Wow.
Yeah, it's a heavy one.
It is.
Okay, the next one is clonazepam, which is also known as Klonopin.
Okay.
So this is classified as an anticonvulsant. It's also a benzodiazepine,
Mm-hmm.
primarily used for epilepsy and panic attacks.
Okay.
Potential side effects, drowsiness, nystagmus, which is rapid eye movement,
Uh-huh.
diplopia, which is double vision, nausea, constipation, suicidal tendencies, and anemia.
Wow, that's a lot.
Yeah. Nursing considerations here. Do not use with alcohol.
Yeah.
No abrupt discontinuation.
Okay.
So you can't just stop taking this all of a sudden.
Yeah.
It says monitor mental status. And then it gives a whole bunch of symptoms that you need to notify a healthcare provider about immediately, including yellowing of the skin or eyes, pale stools, bleeding, fever, sore throat, and, again, suicidal thoughts.
Oh, my goodness.
Also wear a medical ID bracelet or necklace and avoid activities requiring alertness.
Yeah. That's a lot of stuff.
Yeah. So big things here are no alcohol at all.
Right. They make that very clear.
Yeah. And if you have any of those symptoms, tell somebody immediately.
Right.
Also, that medical ID bracelet and necklace is super important, especially if you're taking this for epilepsy.
Yeah.
Okay. Disulfiram. It's also known as Antabuse.
Well,
So this is classified as a psychiatry agent, other alcohol antagonist.
well, interesting.
Yeah. Primary use, chronic alcoholism.
Makes sense.
Yeah. Potential side effects.
Yeah.
Hepatotoxicity, which is damage to the liver, a metallic or garlic taste in your mouth, and impotence. Yeah. Nursing considerations here. Contraindicated if alcohol has been consumed within the last 12 hours.
Okay.
Contraindicated without patient's full knowledge.
Right.
So they have to know that they are taking this.
They have to agree to it.
Contraindicated with recent metronidazole use.
Oh.
Contraindicated in individuals under 18. And it's also contraindicated, or not recommended, I should say, in women who are breastfeeding.
Wow. It's interesting that it can't be given without the patient's full knowledge, right? Like,
Yeah, that's really important.
ethically, that's a really big
Yeah.
consideration, right?
Absolutely.
Yeah.
You can't just slip this to somebody.
Right. Right.
And that metallic or garlic taste in your mouth.
So weird.
Yeah, that's so specific.
Yeah.
Okay, moving on, we have fluoxetine, which you might know as Prozac.
Yes.
This is an SSRI antidepressant.
Okay.
Primary uses: major depression, OCD, bulimia, panic attacks, and episodes of depression and bipolar disorder.
Okay.
So a wide range of uses for this one. Potential side effects: seizures, suicidal thoughts, serotonin syndrome, MI, which is myocardial infarction, or a heart attack, headache, dyspnea, or shortness of breath, flu-like symptoms, NMS, dysrhythmias, rash, and impotence.
Oh, my goodness. That's a lot.
Yeah, that's a lot. So nursing considerations.
Okay.
Assess ECG in cardiac patients. So if they have a heart condition, you got to check their heart.
Right.
Avoid alcohol and other CNS depressants. Avoid activities requiring alertness. Photosensitivity may occur, and orthostatic hypotension.
Right.
So again, it's interesting here that it's used for so many different conditions.
Yeah, a wide range of conditions.
And also that we have to check the heart in patients that have cardiac problems.
Yeah, so many things to consider with this drug.
Yeah. Okay, next is imipramine, also known as tofranil.
Okay.
This is another tricyclic antidepressant.
Okay.
So same class as the first one we talked about.
Right.
This is primarily used for major depression and, somewhat surprisingly, enuresis in children, which is bedwetting. Yeah. So it's an antidepressant, but it also can help kids who wet the bed.
Interesting.
Yeah. Potential side effects. Suicidal thoughts, dizziness, and drowsiness.
Okay.
Nursing considerations. Contraindicated with MAOIs and SSRIs.
Okay.
And it says, may take 2-3 weeks for full results to be seen.
Okay.
So you got to be patient with this one.
Yeah, that's a good point. You got to be patient. I think that's true for a lot of these medications.
Yeah.
Yeah.
Again, fascinating that it can be used for both major depression and bedwetting in children.
Yeah, I wonder how that works.
Yeah.
I wonder if they know.
How does it do that?
Yeah.
And also that it can take a few weeks to see the full effects.
That's really good to know.
Okay, lithium.
Oh, lithium. Okay.
That's a familiar one.
Yeah, lithium. Okay.
So this is classified as an anti-manic,
Okay.
primarily used for mania and bipolar disorder.
Right.
Potential side effects:
Mm.
headache, drowsy, dizzy, hypotension, dry mouth, anorexia, nausea, vomiting, diarrhea.
It's a lot of GI upset.
Yeah.
Yeah.
So nursing considerations:
Mm-hmm.
monitor for toxicity
Mm-hmm.
by doing blood tests monthly.
Oh, wow.
Yeah. Do not operate heavy machinery.
Right.
And the therapeutic range is 0.4 to 1.0 Merrick EQL.
Okay.
So that is the range that you want the lithium levels to be in the blood.
Right.
So not too high, not too low.
Right. Right.
So super important here, monitor for toxicity, because if the lithium level gets too high in the blood, it can cause some serious problems.
Yeah. Monthly blood tests. I mean, that's huge.
That's a lot. Okay, olanzapine, also known as Zyprexa.
Okay.
So this is another antipsychotic,
Okay.
primarily used for schizophrenia and bipolar disorder.
Okay.
And the side effects seem a little less severe.
Okay.
Agitation, abnormal gait,
Okay.
insomnia, cough, and pharyngitis, which is a sore throat.
Right. Right.
But the nursing considerations still say monitor mental status,
Yeah.
assess renal and liver function and blood pressure, and avoid alcohol.
Wow. Okay. So
Uh,
even though the side effects seem less severe, it still requires pretty significant monitoring from nurses and healthcare providers.
That's true. So it's interesting to see how even within a class of drugs like antipsychotics,
Yeah.
the side effects can vary quite a bit.
Right. Right.
But it's still really important to monitor for those other things.
Yeah. Super important.
Okay. Next we have paroxetine, which is also known as Paxil.
Okay.
This is an SSRI antidepressant,
Okay.
primarily used for major depression, panic disorders, anxiety disorders, OCD, and PTSD.
Oh, okay.
Potential side effects: headache, nervousness, insomnia, anxiety,
Oh, wow.
tremor, fatigue, dry mouth, sweating, and abnormal ejaculation.
Right.
Nursing considerations: assess mental status, CBC, and blood pressure. It causes dry mouth, and this is contraindicated in pregnancy.
Okay.
So really important here. A lot of uses for this.
Yeah. And also that contraindication in pregnancy.
Yeah, absolutely.
That's really important for women to be aware of.
That's true.
Okay.
Okay, Fatalzine, also known as Nardil. So this is an MAOI antidepressant.
Right.
And it says it's used for major depression, but as a last resort.
Okay. That's interesting.
Yeah, so that tells you something right there.
Right.
Potential side effects: dizziness, headache, arrhythmias, and weight gain.
Okay.
Nursing considerations here:
Yeah.
NO alcohol,
Right.
contraindicated with other antidepressants.
Okay.
Monitor input and output.
Okay.
Do not take medication in the evening.
Okay.
And NO-OTC meds
Oh, wow.
or tyramine
Oh.
because of the risk of hypertensive crisis.
Oh.
Yeah, so that's a huge
A lot.
list of restrictions.
Yeah, that's a lot.
So if it's a last resort drug and then it has all those restrictions, it's got to be pretty serious.
Right. That's crazy.
Yeah. That risk of hypertensive crisis with tyramine is not something to mess around with.
Absolutely not. No.
Okay, next is sertraline, which is also known as Zoloft.
Zoloft. Okay.
This is another SSRI antidepressant
Okay.
used for
Yeah.
major depression, OCD, panic attacks, PTSD, and anxiety. Potential side effects: insomnia, agitation, dizzy, headache, fatigue, nausea, vomiting, diarrhea, and male sexual dysfunction.
Okay.
So the nursing considerations here: assess mental status. It causes dry mouth. Monitor blood pressure. liver function,
Yeah.
and also risk for injury.
Okay.
Really interesting here that it mentions male sexual dysfunction.
Yeah. And I think it's really important, too, to talk about, any potential side effects with your doctor.
Absolutely.
Even if they're a little uncomfortable or embarrassing or anything like that, it's important that,
Absolutely.
that you have open communication.
Absolutely. Open and honest communication
Yeah.
is super important with this stuff.
Yeah.
Okay. Thiordazine, also known as Mellaril,
Okay.
is another antipsychotic,
Okay.
primarily used for schizophrenia.
Okay.
Potential side effects: dry mouth, nausea, vomiting, headache, rash, constipation, Parkinson-like symptoms, and increased risk of death in elderly patients with dementia.
Wow.
Nursing considerations: assess mental status, monitor input and output, ensure good oral hygiene, and it's contraindicated with SSRIs,
Okay.
and avoid alcohol.
Yeah. So again, we're seeing that,
Yeah.
some of these common side effects with that really serious risk
Yeah.
for dementia patients.
Yeah.
And also that it's contraindicated with SSRIs.
Yeah, really important to make sure that that all of your medications are okay to take together.
Yeah, and that your healthcare providers know everything you're taking.
Yeah, absolutely. Okay, last one, trazodone. It's also known as Molipaxum.
Okay.
So this is a seri antidepressant, which stands for serotonin antagonist and a reuptake inhibitor,
Okay.
primarily used for major depression.
Okay.
Potential side effects:
Oh.
dizzy, drowsy, orthostatic hypotension, ECG changes,
Oh.
tachycardia, blurred vision, diarrhea, dry mouth.
Wow. Okay.
So the nursing considerations here:
Mm-hmm.
assess mental status, monitor blood pressure,
Mm-hmm.
ECG, CBC, and it says caution with suicidal ideation. Really interesting here that it mentions ECG changes specifically.
Yeah. Yeah. That's interesting.
Yeah, so it can affect the heart.
Right. I mean, I think, it's a good reminder that, even though a lot of these medications are for mental health,
They
they
affect the whole body.
can affect other systems of the body.
Yeah, that's true. Okay, now towards the end here, it gives us a little bit more information about what serotonin syndrome is and what neuroleptic malignant syndrome is,
Okay.
which have been mentioned throughout this entire list as potential side effects.
Right. Right.
So serotonin syndrome can be really serious.
Yeah, it can range from really mild symptoms like shivering and diarrhea to really serious ones like muscle rigidity, seizures, and even death.
Yeah, it's basically when there's too much serotonin in the brain,
Yeah.
and then neuroleptic malignant syndrome. This is also very serious.
Yeah, that's a really bad reaction to antipsychotics.
Yeah.
High fever, sweating,
Yeah.
unstable blood pressure, decreased level of consciousness, muscle rigidity.
Yeah.
So definitely need medical attention for that.
Yeah, absolutely. And then it mentions that you should only use one antipsychotic drug at a time,
Right, right.
just to be safe.
One at a time. Yeah.
And it says, if tardive dyskinesia occurs, stop the drug or taper off the drug.
Yeah.
And then finally it says that flumazenil is an antidote for benzodiazepines.
Okay.
So if somebody overdoses on a benzodiazepine, flumazenil is what you would give them.
That's good information
Yeah.
for emergency medical personnel
Yeah, that's true.
to have on hand.
So, wow, we covered a lot of stuff today.
We did, yeah.
That document had so much information in it.
That was a really good deep dive. I learned a lot.
Yeah, I feel like we just scratched the surface.
Yeah.
We talked about what these drugs are called, what they treat, how they're classified, all the potential side effects, good and bad, and then also the nursing considerations.
Yeah. And I think, the big takeaway for me is that these medications are so complex.
Yeah.
There's so much to think about.
They are.
And it's really important to have a healthcare provider
Yeah.
that you trust
Absolutely.
and who you can communicate with openly.
Absolutely. So after going through this whole list, I want to leave you with this thought.
Mm-hmm.
What does it say about the personalized nature of mental health treatment? That we have all of these different drugs
Right.
that are all used for slightly different things.
Right.
And some of them work for some people and some of them don't. Some of them have bad side effects, some of them don't. It's really a complex field.
It is, and I think it speaks to, just how individual each person's experience is
Absolutely.
with mental health. And, it really underscores the need for that careful monitoring
Yeah.
and communication with healthcare professionals
like that.
throughout the process.
Absolutely. So, hopefully this has encouraged you to maybe look into some of these medications in a little bit more detail, or to, learn more about psychopharmacology in general and how all these medications work.
Yeah, it's a fascinating field.
It is. Yeah. Thanks for joining us for another deep dive.
Absolutely.
We'll see you next time.